Welcome back to Talk 1260 KTRC, the Humanity Behind the Vanity. We just heard from Dr. Scott Thomas, we heard earlier from Mark Wood, and now we're going to talk about what's going on in the new issue of New Beauty magazine.
Woo! Here it is with Madge on the cover looking fabulous at 50.
Yeah.
Okay, so what are you going to reveal to us, Big Dr. Ronel?
Well, there's an article there on how to look 10 years younger.
Right, the secrets to looking 10 years younger. And Madge is featured because although I think she denies having work done, which is fine,
Okay.
she has had to have work done in order to look this fantastic. And we've all seen, probably, those of us who watch silly shows like I do, like E! Channel and Entertainment Tonight and look at Us Magazine and stuff. Sorry, these are my guilty pleasures. And we saw that horrible photo of her when she clearly just had her cheeks filled and she wasn't wearing makeup. She had probably just come from working out and everyone made fun of her and just insulted her to no end. That woman had her cheeks filled in that photo when she just looked really huge. And what happens is, with some fillers, every other filler but Artifil, at least in my experience, will really swell you up in the initial plumping phase, the initial injection phase.
That is something that I've noticed too about Artifil.
Artifil does not do that.
It doesn't cause as much swelling as the other fillers. It can, but overall, it really doesn't.
Yeah, I mean, I'm going to get some more in mine, and I feel so comfortable with Artifil that, you know, you can do it and we're going to have dinner with the people the next night, dinner with friends the next night, and I'm not worried about it. Whereas if it were other fillers, they are just as fantastic. The results I have are that I am incapacitated for several days. Anyway, enough about me. Let's get on to this.
Okay.
So let me start asking you, Doctor. Here we have one secret is having full cheeks. Mm-hmm. Discuss.
Okay, 2 ways to fill cheeks. Let me take one step backwards. As we age, our fat pads on our cheeks drop down, and that's what deepens that fold between the nose and the lips, right? The nasolabial fold.
Not you, Gino.
And it ages people. Gino's our producer, if you're not watching. For those of you watching
we
on
love
YouTube.
Gino. There's his hand. And it's always his big head you see on the videos. Okay.
So as we age, the fat pad of the cheek drops off the bone, the malar eminence. And a very rejuvenating thing is to recreate sort of that apple cheek of youth. And you can do it with filler, you can do it with a cheek implant.
That would have been a facelift for women who were blessed by God with beautiful cheekbones to begin with.
Yes, absolutely.
Okay.
A facelift will also
Lucky
restore
girls.
the cheek. But we're just talking about, you know, what you can do, for example, in the office.
Okay.
Although I think putting in cheek implants is really not a great procedure to do in the office because it can be pretty complicated. And
oh, no.
the recovery time is more significant than one would think. I think putting in a filler, especially a long-acting filler like Artifil, is a fantastic way of rejuvenating the cheek. So that's one thing.
Right. Okay, we've covered that now. So the full cheeks, and it says here Madonna's cheeks are full and defined. They sit high up on the bone, which gives a youthful look, and also prevents the deep folds from forming around the mouth. Right, so there we go.
What makes a cheek aesthetically, the elements of a youthful cheek are that the apex is a little bit to the outside, lateral,
right,
and it's oblique, so it's tilted and it's oval. That's what makes a beautiful youthful cheek.
Yeah, you know, like the Swedes have it, the Germans have it, right? Those people are just born with it.
Right.
God bless them. All right, so another one here, smooth forehead.
Okay, so the way to smooth the forehead is to do a brow lift. There are some people who do injections in the forehead of
Botox.
a filler, but I don't think that's a great idea. Yeah, Botox can do it.
That's what I do. That's
yes,
what a lot of people
it's
do.
a temporary measure that lasts 4 to 6 months, and
Right.
it can get expensive.
But when you're in your 30s and you're really not ready for a brow lift,
Absolutely.
all you can do is Botox.
Right. And if you're not ready for the recovery time of having a brow lift, then Botox is a great solution.
Right.
Something that's a little more definitive and lasts longer is a brow lift, and there are now minimal incision brow lifts. It used to be that people used to do what's called a coronal incision, all the way across the front of the forehead, the scalp.
Right.
But what's really important is, in a woman, is to have the lateral third of the brow elevated above the bone, the orbital rim there. And that only requires a small incision behind the hairline. And in fact, you can bevel the incision so that the hair bulbs grow back through the incision and hide it, which is very nice.
Can you bring down a hairline? You know how our hairlines all recede?
That's very difficult. That requires an excision of the skin in front of the hairline, and it can be done. I just actually did one last week on a man, because for a man, the brow lift is a little different. That's more of a central brow lift.
Oh, really?
As opposed to what we're talking about, which is more like the old school brow lift.
Why is it different?
Just because aesthetically, a man should not have an elevated brow in the lateral third, because that's very feminizing.
Or Spock-like.
Exactly.
What about the women who kind of, to me, you know, like I know this woman around here, she's really gorgeous actually, except for her brows are like whoosh, Spock-like. I think she likes the way she looks,
right.
And I don't know if it's Botox or a brow lift or what, but to me she's gorgeous minus the brow. It's quite odd.
Your opinion is that her brow is still too tightly, you know, and that can happen. It can give you sort of an unnatural look if it's pulled too tightly. That's true of anything, a facelift, a neck lift, you know, a breast augmentation, if anything's done too much. Right.
Okay, yeah.
And so this minimal incision technique helps avoid that. Now, that New Beauty mentions the endoscopic brow, which is a great thing. It came onto the scene about 20 years ago, developed in Georgetown, and I did them, and then I personally have gone away from them because I think I can achieve the same results without the third incision that's required with an endoscopic
Where's
brow.
The third?
It's right in the center. And
of the hairline.
In the hairline, right.
Isn't that where the incision they make, where they cut that muscle that gives everybody the frown lines that you treat with Botox? That's what I want to get rid of.
Okay, no, that's a corrugator muscle excision, and that's way down here. That's right at the right. And when you do an upper blepharoplasty, that's when you can cut that incision. You can also get to that muscle through an endoscopic brow.
Right, that's how I learned about that. Okay.
But I think that's just a little bit more complicated than needs to be. Okay. But there are people who do endo brows, they look fantastic.
Yeah, I mean, it's an art. Right. No artist paints the same, no surgeon cuts the same. Period. Very simple.
Right.
Okay, can we move on?
Yes.
Wide eyes. Madonna's upper lids still have a natural crease, and her lower lids are free of bags. So you know at age 50, no matter how good you are, how good you eat, how much you exercise, it's the natural aging process. So she must have had her eyes done, and she looks fantastic.
There's a couple ways to do the eyes. If you're still young, most people over 40 start to have wrinkles. If you're young, you can have some laser resurfacing.
39.
Okay. Laser resurfacing, but it has to be done by a really good esthetician or somebody who knows how to run a laser.
Right.
But a blepharoplasty, an eyelid tuck, is now a pretty simple office procedure. So is a brow lift, by the way.
And you do the eyes in your office.
Yes, and the brow also.
Oh, I didn't know that.
And you can do all three in the office. And it's
at once?
Yes.
Okay.
It's a very rejuvenating procedure, and a small incision is made, for those of you watching on YouTube, for the lower lid, just at the end of the lower eyelashes. Almost everybody has a natural crease.
Show it on me, because I want to see.
Right at the end of the lower eyelashes, everybody has a natural crease there.
Right.
And it goes out into the crow's feet.
Gino, you watching?
For the upper eyelid, everybody has this sulcus, this thing right there. Close your eye. If you close your eye, then you can...
Yeah, the natural crease that eyeshadow gets caught in. Okay.
Right, so that's where the incisions are made. Okay, our producer is telling us that we have to wrap things up.
Oh no, we had spot-free skin left.
Okay.
Oh well, that's a Marion topic.
We will talk about those things later. Thank you so much for listening to Talk 1260 KTRC, the Humanity Behind the Vanity. This has been Dr. Daniel Ronel with my wife Betsy.
And we wish everyone a very happy new year. We hope it brings you all the things you want and need. And lots of peace, enlightenment, and harmony.
Absolutely.